We now officially get into our health segment, and today on Health Check, we are looking at regenerative medicine. What exactly is that, and what are some of the conditions or diseases that get to be cured through regenerative medicine? The doctor is here to let us in about all that. Her name is Dr. Ashni Malde. She is an aesthetic doctor and the MD Tia Clinics. Welcome to the program.
Thank you so much.
It's a pleasure to have you on the show this morning.
I'm pleasure to be here.
All right, let's begin by first defining what exactly regenerative medicine is.
Okay, so regenerative medicine, quite self-explanatory with the word, means regeneration. There's so much that's advanced in the medical field, and we're trying to do things as naturally as possible. And so when we talk about regeneration, it literally means that we can regenerate anything in the body. Science has gone so far that you can grow teeth now, you can grow back your organs now. Of course, we're not yet there in Kenya, but we're trying to be there. And so I'm here for that purpose, to explain what we can regenerate. When it comes to aesthetics, we regenerate hair, we regenerate your skin. We also help you with other issues in the skin. And of course, other specialties do regenerate quite a few things like tendons, ligaments, you know, areas around the bone. It helps in male and female rejuvenation. So we're really trying to advance and be as non-invasive as possible, because we all know everyone's scared of surgery. Not everyone is meant for surgery, and so we now have options.
All right, well explained. So just how different is it from traditional medicine?
It's pretty much similar. We are very basic way of doing regenerative medicine or practicing regenerative medicine is using your own blood. So it's still medicine. It's still traditional medicine. We only take your blood, purify your blood, and we inject back your blood in the area that it's required. And so if we're doing hair regeneration, we're injecting it back in the hair. If we're doing skin regeneration, we're injecting it back in the skin. If we're helping male and female rejuvenation, then we're injecting it back in that area. Well, it's more advanced because one, it's non-invasive, so you know, patients don't have to go through surgery. It's almost painless. It's an outpatient procedure, so it's a walk-in, walk-out. Patients can do whatever they want after the procedure. We don't stop you on your lifestyle, so no hindrances in lifestyle. And yeah, that's how it's beneficial.
Wow, it sounds really interesting, you know. I'm sure that it is quite new for most people, you know, because we're used to the traditional form of medicine. And, you know, just to get to know that you can be able to regenerate your skin, you know, you can be able to regenerate hair for those who have hair loss. You know, it's really quite interesting. If we try look at some of the conditions that may be, you know, cured via regenerative medicine, what are some of these conditions?
Okay, when it comes to aesthetics, of course, it's all about looks. But yes, even alopecia is a condition. Alopecia is when you've lost your hair. Well, we do have some guidelines which we need to follow in terms of if you're completely bald, I can't use stem cells to regenerate hair and grow back all your hair. There's another treatment for that. But if you have hair thinning, then definitely this really works for you. With your skin, if you have scars or if you are a burn patient, then regenerative medicine works really well. A lot of patients who may have ulcers, it works really well on the skin. It's a miracle when it comes to pain management. So it's very good for orthopedic surgeons to use, because not everyone is eligible for surgery. Maybe they're too young, maybe they're too old, maybe they can't afford it, maybe they're just not a candidate for surgery. And there could be that 50% of a chunk of patients that can't do surgery for whatsoever reason. This is an alternative. It's non-invasive. So it's life-changing for the patient and for the doctor.
Are there organs in the body that are most regenerative? I understand the liver is. So if you can just speak a bit about that.
Yes, I think at this point we can regenerate anything.
Oh.
As I mentioned, we're growing teeth now. Of course, it's not happening in Kenya yet. And what I'm talking about today may not be the appropriate way of regeneration for organs or teeth or any body part, so to say. It's more superficial.
Okay.
But yes, science is quite advanced, so anything in the body can be regenerated at this point.
Yeah. Now, let's look at the skin, you know, for someone who's looking, you know, aging, most of us don't want to really age. Like, we appreciate aging, but we do not want to look like we're aging. There's actually a phrase that we all use, you know, aging like fine wine. You know, you don't want to look old, but you want to, you know, keep living and aging, yes. So let's talk about, you know, regenerative medicine when it comes to the skin and ensuring that you age gracefully, if that's the term to use. Like, you know, you don't have the fine lines and the wrinkles and whatnot.
So you said it rightly. No one wants to age. In as much as I do get patients who come in and say, I don't care, I want to age. But you don't want to look old. You don't want to have wrinkles on your face. And this is where now regenerative medicine is really advancing. We've all heard of Botox, fillers. We've all heard of lasers. A lot of these things are quite outdated now. Regeneration is in. It's functional medicine, actually. We're trying to make you age gracefully and slowly and naturally. So there are a lot of products, procedures that we do. As I mentioned, the first thing is use your own blood. Get your stem cells out of your own blood. They're called growth factors. And we inject the growth factors back in your skin. That's the most natural way of regeneration. It's a very slow process. So for example, you walk into a clinic and get fillers done. We all know about fillers. You look so nice instantly, but it's something that will reverse back in a few months. Or you'll age again and you'll go back for fillers again. As compared to regenerative medicine, it may be a slower process, but a short process. So you're not going to age back from there, because what we're trying to do is build your own collagen. Collagen is the elasticity of the skin, and that's what makes or keeps you firm and tight. And so that would be one of the first steps in regenerative medicine. Of course, there's so many other more advancements in terms of biostimulators, fat transfer, quite complicated things, but as the term, you know, says itself, fat transfer, fat is removed from one area and injected back in the face or anywhere in the body. But yes, we have just launched regenerative medicine kits, whereby we do have an additive, which is hyaluronic acid. Hyaluronic acid is basically also one of the components under your skin, which maintains elasticity of your skin or gives you the firmness in your skin. And so we take your own blood, purify your blood, get the growth factors, which are the stem cells, add the hyaluronic acid to it, and inject it back in your face. And that would prevent aging more constantly, more, I would say, more in a long-term way, as compared to doing something instant and then coming back for procedures again.
You've spoken about collagen, hyaluronic acid. You know, these components that are usually in most of our skincare. You know, for those who do skincare routines and whatnot, you know that, you know, you'll find hyaluronic in your moisturizer or just as it is, you know, as a hyaluronic acid as a serum and whatnot. So what you're talking about is, if you decide to go the regenerative medicine way, you would not need, or you will not need to use this products, or?
Well, you can, because they're more maintenance. So anything you're applying on top of the skin is only penetrating so much into the skin. So we're putting the stem cells inside your skin to regenerate your own collagen. And then what you're applying on top is just a maintenance, because you're not going to come to me every day. So we do something a little bit invasive for you, and then you go home to maintain for the rest of the time before you come in for your next appointment. But just using the collagen or the hyaluronic acid products on their own may not be as efficient as what we do in-house. So a combination works best.
So it's not an instant thing. So you need to go in for several sessions maybe?
Yes. So in science, regeneration takes up to 3 weeks for anything in the body. And so, of course, that will be your first step. First 3 weeks to show you some slight changes. With our regenerative medicine kits, we strongly advise 3 sessions. That's 1 session every month. And that's kind of it. And then you don't come back to us for another 2 to 3 years. However, we do have other maintenance treatments. So we make a whole plan for you and we'll tell you, okay, let's start with regenerative medicine and then move on to maybe hydrofacials, which is less invasive, more maintenance treatment, and then possibly do something like microneedling. So yes, if the aging is too much on a patient, then we would advise for something like thread lift. That's also inducing your own collagen. So it's a product which is like a thread, and we put it under the skin and it dissolves, and then it enhances your own collagen. So it regenerates your own collagen. And we've had fabulous results with that as well. So we design a whole treatment plan for you because every individual is different. Maybe you would have come in with a burnt skin. So you know, because of using adulterated products which are in the market. So your treatment plan will be different. And we know that. We've seen that quite often now. You know, so many adulterated products in the market, people using them, bleach cream, steroids, and then coming back to us with totally burnt, damaged skin. And now that's where we play a role and rectify it because we're causing the regeneration to happen.
All right, so still on the skin, maybe just how long does it sustain you? Say I come in for the procedure, you know, I wanna remain this young for the longest. How long can it sustain me before I start seeing changes or the aging signs one more time?
We guarantee you anything between 2 to 4 years. So you don't come back to me for at least 2 years. But it also depends on your lifestyle. Are you a chronic smoker? Do you drink alcohol? You know, do you have a bad lifestyle? What are your sleep hours like? What are you doing at home to maintain in terms of your skincare products? What are your stress levels like? So all those definitely play a role. But of course, we still guarantee you anything between 2 to 4 years till you come back to us.
All right. Okay, you can also be part of this conversation. Remember, our WhatsApp line is open. You can get to WhatsApp us. If you have any question for the doctor, she's here just for you. So she'll be answering your questions. The number is 0716 103 301. 0716 103 301. If you have any questions concerning regenerative medicine, you can go ahead and shoot it to us. We'll go through it. Now, that's with the skin. For hair now, you know, for someone who's lost hair, they're completely bald and the hair is not growing back. Or for most ladies, we know we have issues with our hairline sometimes, you know, like the hairline is just not growing. Your hair is starting from somewhere over here, you know, because of the stress we put while just plaiting our hair all the time. So let's talk about the regenerative medicine or regenerative way of ensuring that, you know, you have your hair back.
Okay. So as you said, it would help with loss of hairline. But when the hairline is lost completely, then unfortunately we can't do anything with the stem cells. Then now we have to do something called a hair transplant, where we're using your own natural hair, getting it from the back of your head and replanting where you don't have the hair, so in the front. However, if you just have thinning hair or you have a vague hairline, and you lost it maybe because of too much of traction from the braiding, or you lost it maybe postpartum, then definitely we can restore it with the growth factors. Although wigs, weaves do play a major role. So even if we are doing any kind of regeneration, even if we're doing hair transplants, we will stop you from using these for quite a few months, because what happens is they're quite tight. They impinge on the hairline. And so even if we're injecting stem cells to regenerate the hair, the baby hair will be suffocated and it won't grow because of the impingement of the wig. So there are a few restrictions when it comes to restoring hair. But definitely in the long run, it's the best because now you'll have your natural hair. A lot of people want to go natural now. A lot of people are getting off the wigs, the weaves, even the braiding, so to say, and they just want to have natural hair. So there's options. Also for those who suffer from complete hair loss, there are people or patients who come to us who don't have hair at all, and we have a treatment for them as well. So we just put them on medications and we actually grow back all the hair.
Okay, so most of these procedures are completely non-invasive. Like all you need to do is just inject something into the body.
The hair transplant is a little invasive.
Okay.
It's still called a microsurgery, so we're not cutting you open anywhere. We're just getting your hair follicles from the back of the head. So for example, if you see an old man, he'll be bald at the top, but he has hair at the back. That's the strongest hair we have in our body. And so we remove the hair follicles from there, one follicle at a time, and we replant it back in the front where you are bald. So that's slightly invasive. It is a 2-day procedure, in as much as it's an outpatient procedure. And apart from that, the stem cells, completely non-invasive, 5 to 10 minute procedure. If you're totally bald, then we don't do anything invasive at all. We only put you on medications. And we grow back all your hair, be it eyebrows, be it eyelashes, be it the head hair, be it body hair, all of it grows back.
Amazing. That's really, it's good to see just how, you know, things have changed over the years, and right now it's easier to, you know, cure most of these things, or just to, it's just easier. I think life has become much easier, you know, with technology and all of that. Just how receptive are Kenyans to these treatments?
Initially, it was a rough road because a lot of people used to have stereotypes of, oh, if I do a hair transplant, I'll get brain cancer, or I'll die from a hair transplant. But I think with time, people have learned to understand. There's so much awareness, you know, social media really plays such a big role. And I think patients are a lot more educated. So we do get patients who come in and they know exactly what they want and how they want it. They're totally aware of everything. Makes our life easier because they already understand the concept and they know what they're going in for. And so yes, it's been a good, you know, response from patients. They love our treatments. We are sure results, especially when we're doing regeneration for pain and patients who suffer from pain. We've seen miracles. And when I say miracles, we generally don't talk of miracles in medicine, but I've literally seen miracles. I've seen my patients call me back the next day screaming that they're free of pain. They don't have pain that was 10-year-old, 20-year-old pain. So it's quite good, and it's quite satisfying, I'd say.
I can imagine. Let's get into that actually, you know, regenerative medicine for pain. So how does that look like? Kindly just get us in on that, you know, for any kind of, is it for every kind of body pain or other specific pains? Just let us in on it.
We try, I would say we try and treat 99% of types of pain, whether it's a post-surgical pain, whether it's pain from an accident or trauma, whether it's pain because of degeneration. So when I say degeneration, I'm talking about something like arthritis. We all know about arthritis. So any kind of pain, we're only managing the pain. I'm not the specialist here because I'm not an orthopedic surgeon or any of pain management specialist, but I do help my patients only because I'm also the one who studied all about the stem cells and regenerative medicine, and now we have our own brand here in Kenya. Well, it does help, and as I mentioned, we've seen miracles. We've repaired tendons, ligaments. We've treated patients with osteoarthritis grade 4, which is like the most extreme, and patients come back to me literally the next day thanking me that they don't have any pain. I would say that's 90% of the chunk of patients that I would treat for pain. There are those 10% who do require the 3 weeks for regeneration. And of course, we say scientifically it's about 30% reduction in pain for every session they do. And that's why the 3 sessions. So 3 months, and then we guarantee them about 90% reduction in pain.
Okay.
But yes, any kind of pain, be it damage from the gym, torn ligaments, torn tendons, torn muscles. Patients come with pain in their feet, in their knees, in their ankles, in their neck, in the shoulder. We can treat it all.
Okay. There's some messages that are coming in, but before I read them, just how expensive or cheap are some of these treatments, and do you take insurance? Because probably there's someone who's watching and they know they have arthritis, or they know someone who has such, and you know the pain is usually unbearable, and to know that there's a way that they can ease that pain or get rid of it completely, probably they would want to know just how expensive is it, how cheap, and do you take insurance?
It's quite moderately priced. I would say a patient will spend anything between 45,000 to 200 to 300,000 per session. So if it's 45,000, then 3 sessions will be 135,000. So it's not that expensive, so to say. Unfortunately, this is not covered under insurance.
Okay.
And it's still in study for insurance companies. We would like to appeal insurance companies to take it on board. I don't know if that will ever happen. But yes, I think it's something patients definitely can pay out of their pocket, because it's not even as expensive as they would go in for surgery or something.
Okay, so let me read some of your messages. Remember, you can send your messages. The number is 0716-103-301. Send in a WhatsApp message. Someone is asking, hello doctor, can we use a regenerative medicine for diabetic patients? And then another one is saying, hello, what regenerative medicine treatments are currently available for reversing male pattern baldness? You've touched on it. And how effective are they compared to traditional hair restoration methods?
Okay, so let's start off with the question on diabetes. No, regenerative medicine will not reverse diabetes.
Okay.
Although China just came with a breakthrough and they're using stem cells to cure diabetes completely. It's going to be a major game changer for the world. But we do have an alternative treatment, which is called an antioxidant therapy. And I have treated about 50 to 60 cases of diabetes till today. Again, I'm not a specialist, not my forte. Of course, my patients came in for something else, and studies show that it does help with diabetic patients. So I believe they can reach out to us and we can do a consultation and explain to them how we can, treat the diabetes. As for the male pattern baldness, I already explained. If you're already quite bald, then it's not going to work for you. You will have to go in for a hair transplant. I'm not sure what he's or she's mentioning in terms of traditional hair restoration methods, but most of the traditional hair restoration methods are outdated. A hair transplant has 99% success. And we've given really good results for a lot of our patients who we do hair transplants for.
Okay. Someone is asking about an irritable bowel syndrome.
I'm not so sure.
Okay.
Again, not my forte, so I wouldn't be able to say much.
All right. Someone is saying, my issue is my hair growth is constant. How can you help me? I think you've touched on that. You've talked about the baldness, because their question was, my issue is my hair growth is constant. How can you help me? I'm really disappointed with my hair. Okay.
I think also what a lot of people need to know is there's a lot of basic care that you can do at home in terms of oiling your hair, taking supplements, washing your hair from time to time, washing your hair with medicated shampoo from time to time. These are the most basic things that patients can do at home. And so constant hair growth shouldn't be a problem, because I think they're trying to say that their hair doesn't grow much in terms of thickness or length. But we also have supplements, so come in for a consultation and we'll be able to explain more.
All right. Does it help with gray hair? Someone just asked about grey hair.
Unfortunately not. We're not yet there
Okay.
in advancement, but we're hoping that we can reverse the graying as well at one point.
All right. Just how close are we to using regenerative medicine widely, you know, in clinical practice right here in the country? Because you mentioned it's being done, you know, out there in China for teeth and some other organs. How close are we as Kenya to getting to that point?
I would say we're only 20% yet there.
Okay.
Well, I carry another hat. I own a pharmaceutical company, and this is why we have our own kit. And we try to urge doctors to use it. I do have so many colleague doctors out there who do use our regenerative medicine kit, and they've had fabulous results, whether it's treating diabetic foot ulcers, whether it's treating hair, it's treating skin, or it's even just helping manage with pain. So our urge is for doctors to advance themselves. Our urge is for doctors to come and learn. It's pretty non-invasive, not time-consuming, and I think we can really help a major chunk of patients, because at the end of the day, we're the hub for East Africa, and I think everyone looks on to Kenya when they want to come in for any advancements before moving out anywhere else in the world for medical treatment. Yes.
Let's talk about the regulation. Just how well is it regulated in the country? Because I can imagine that, you know, sometimes there was a case some time ago whereby a lady actually died, you know, from, I think, I'm not sure what exactly, what procedure exactly they were doing, but yeah, so the regulation, you know, is it well regulated in the country? Is there somewhere I can go just to check some of the places that are actually authorized and certified to do some of these procedures?
Yes, let's start with demystifying what happened with the lady. That was malpractice. It has nothing to do with how the procedure was, in terms of it has nothing to do with a product, or it has nothing to do with okay, like I'll explain. If you're using the regenerative medicine kit, you can't go wrong, because there's nothing that will go wrong unless you are the one who doesn't know how to inject it. Or unless you are the one who doesn't know how to operate on the patient. But yes, to check eligibility of your doctor, I think we do have our panel of the Kenya Medical Practitioners Board. You can go online and check for our license and see if we have a valid license, just to be sure of where you're getting your procedure done. But let's also accept, I think patients just want to look for cheap options, and then they really don't care. And then when something happens, you know, it goes fatal, is when now there's so much of an issue about it. So sometimes cheap is expensive. So I think we need to watch out on both sides. Yeah,
so just do your due diligence.
True.
If you're planning on going for such treatments, or whichever kind, you know, in whatever field, just do your due diligence. And as she's mentioned, there's a way you can go check online just to see if your doctor is a certified doctor or is allowed to take on such treatments or procedures. The messages keep coming in, so allow me to just throw the questions at you. Someone is asking about cleft palate. Is it something that can be?
We do have a version of our regenerative medicine kit that is turned into gel and then used for regeneration in dental procedures. A cleft palate is a dental or a maxillofacial procedure. But yes, that would really depend on the surgeon if they're up for it to use it. It would just promote faster healing, but it's not an alternative to a cleft surgery. Yes.
All right. There's an interesting question here. Someone is saying they're 31. They've been using alcohol since they were in high school. They quit for some time, but then got back at it, and they're currently using alcohol. And they're asking, could this bring any problems to my life?
The alcohol or the regenerative medicine?
The alcohol.
Definitely. I think they already know that they should be off the alcohol. Alcohol is one of the biggest issues, one of the biggest things that cause issues in the body. It's hard to withdraw, but it really comes from within. So that's something they're going to have to try on their own.
Mm-hmm. Right. I think you've answered this one. They were asking on can regenerative medicine help stimulate hair growth on a completely bald scalp? I think you've mentioned that if it's
Yes.
completely bald, you'll need to do the transplant.
No,
Okay.
we just put them on a treatment.
Oh.
It's majorly just tablets actually, so
Okay.
it's the most non-invasive.
Oh.
And we can completely grow hair. I've just recently had a successful patient who, she's 6 years old. She didn't have any hair on her head, no eyebrows, no eyelashes. And well, I wish I could share the pictures. She has beautiful eyelashes right now, eyebrows. She even has a little hair on her upper lip, a head full of hair. So yes, very successful treatment.
That's really nice. So if you have a bald scalp, yes, there
Look
is
for
hope.
us.
And all they'll need to do is just take tablets.
Of course. It will be under
Amazing.
my supervision.
Amazing.
But yes, definitely they can.
Okay. More messages. Let's see if we'll be able to get through all of them. Someone is saying, good morning, Doc. Is there a way you can help? Is there a way you can be of help on an organ undermined by cancer?
Well, we do, as I mentioned, the antioxidant therapy. What antioxidant means is it reduces oxidative stress in the body, and I'll simplify that into layman. When anything rusts, there's oxidative stress on it. So we're reducing the rust in your body. So science has proven to curb cancer, not to cure it, but they would have to be more elaborate. So it's always best if they come in for a consultation. But yes, we can definitely help you to a certain extent.
Okay. I think most of them are on hair. Because someone is saying they're from Eldoret. I'm asking, how do they transplant hair loss in front, and is it painful, or it's a normal thing? You've answered that. You only need to take tablets, so it's not painful.
Well, if it's a transplant, then we do it under local anesthesia.
Yeah.
So it may be slightly painful, but that's any surgery, microsurgery, but it's not something unbearable. It's, as I mentioned, it's a walk-in, walk-out procedure. So patients literally can drive in and drive back home in the evening once they're done.
Someone is saying, how can she help for a patient who is suffering from hip pain and arthritis? And then what causes early hair growth? Is there any way to control?
Okay, hip pain, arthritis, yes. We've already talked about it. They will just come in for a consultation. We do some diagnostics. We look at their history, and then definitely we can treat them. As for the early hair growth, I don't think that should be a hindrance for someone, unless it's way too much, unless you have someone growing a beard at the age of 6 and she's a girl, just on a light note. But it's possible sometimes because of hormonal imbalances. Then yes, we do have treatments for that as well. We do laser hair removal as well. So in as much as we grow hair, we can remove the hair for you too. And so yeah, they can have a solution to that.
Okay. Let me take one more question. Someone is asking, what's the name of the stem cell you have, and where is it manufactured?
Okay, I explained. It's growth factors which come from your own blood. So our blood has different type of growth factors. The name is quite self-explanatory. It's a growth factor. So it grows anything in the body. There are different types of growth factors. I can name a few, which is insulin growth factor, fibroblast growth factor, vascular endothelial growth factor. And so all these growth factors play a different role in different parts of the body. And so we're getting them from your own blood, which is the most natural way of getting it. And so they're not manufactured anywhere. Because lab made is always artificial, and your own blood is always the best.
Okay.
Yes.
All right. So maybe just what are some of the challenges around, this type of medicine?
Unfortunately, I think that to myself a lot. We don't have any challenges.
Really?
Every single person is a candidate for me.
Yeah.
We can help every single patient. We don't have any side effects to the treatments we do. It's your
None
own blood.
whatsoever.
No, because it's your own blood we're injecting back in your body. It can't go wrong. There's nothing that can go wrong. The only thing that can go wrong is maybe it won't work for you, but there's no side effect. Our antioxidant therapy is also one of the best treatments a patient can take. And there's nothing that can go wrong. We've proven to regenerate the liver completely with the antioxidant therapy. So if your liver is in check, your entire body is in check. And so there's nothing that can go wrong.
Okay. So no challenge whatsoever.
Never.
Interesting, interesting. Major ethical concerns?
Not really. I wouldn't say any ethical concerns as well, because we're literally either just putting on a drip for you or using your own blood and injecting it back.
Yeah.
I would say contraindication, and the only contraindication would be pregnant or lactating mothers. But apart from that, no. And it's only a contraindication because we don't want to pass it on to the baby. But otherwise, once they're done, then they can always come back to us for treatment.
Yeah. Is there a way to ensure patient safety in some of these experimental therapies?
Well, it's not that experimental. It's only experimental for insurance companies. But PRP was, or growth factors were launched in the US in the 1960s. We're just 50 years behind of what they're doing. So, no, and we don't have any restrictions, so to say.
Okay.
Yeah.
All right, let me get back to the questions that are being sent in. Someone is saying they're from Kisumu. Which regenerative medicine can I use for my son? He is 1 year old. Whenever he is sick, his blood level go down. 3 days ago, he had been sick, and the same blood test was done. It was the same. How can I be helped, Dr. Malde?
I'm not the specialist.
Yeah.
I'm not so sure regenerative medicine would play a role at this time. But yes, I think as per personal opinion, they can also do a lot more natural things just to boost the immunity of the baby. Because sometimes we don't want to work on babies so young, you know, they're still growing.
Yeah.
But a pediatrician or a pediatric surgeon would be the best to guide them.
All right. Someone else is asking, I hope I pronounced this right. Can you treat spondylitis?
Not really.
I'm in pain.
We can only manage the pain, but we can't really treat the issue in terms of if there's bone growth or if there's degeneration of bone, then we can't regenerate bone or we can't cut off the bone. But yes, we can definitely manage the pain.
The pain.
Yeah.
Okay. Is there a way of regenerating muscle strength when a patient is suffering from motor neuron disease?
Yes, we're really trying to advance ourselves. So apart from the stem cells that I'm talking about, we have tried to introduce something called peptides. Peptides are the building blocks for amino acids, which are the building blocks for muscles. We've all learned that in science in school. And we do have a lot of peptides on our panel right now that we use for muscle growth, for building muscles, for enhancing the body. And so, yeah, there are options.
Yeah. All right. And with all the messages that have been coming in and still coming in, most of them are all about where exactly to find you. You know, is there a way they can get to contact you for, you know, consultations and whatnot? So if you can just get to mention as we finish where exactly to find you.
So we're based in Muthaiga in Nairobi. And it's called TIA Clinics, TIA. This is Africa, or this is aesthetics. And you can call us on 0799 995716. But you can also just Google us. We're all over the social media platforms as well. TIA Clinics, TIA.
All right. So that's how to find you. You can just find them across all social media platforms as TIA, TIA.
Yes.
Thank you so much, Doc, for joining us, and thank you for giving hope to giving us hope to some of the things that we may be suffering from, and probably one was just sulking, wondering, you know, just how am I going to ever get rid of this kind of pain. There's hope, clearly. So if you may just give us your parting shots.
Yeah, there's hope. We're no longer in traditional medicine ways, or we're no longer, you know, constricted to what we used to do as doctors. There's so much advancement. There's so many more cheaper options. So we're trying to make it as feasible as to as many Kenyans as possible, for those who can't afford, for those who are not candidates for surgery, for those who have issues but never got treated for whatsoever reason. Look out for us. Regenerative medicine is the way forward. We're trying to make you age gracefully, age naturally, and we're only trying to help you to, you know, treat a problem that's in the body. So look for us at Tia Clinics, Muthaiga, just next to Gertrude's Hospital.
All right. Thank you so very much, Dr. Ashni, for joining us. We appreciate
Thank you.
we appreciate you for gracing our show today.
Thank you, and it's a pleasure to be here.
Awesome. This is where we get to end Good Morning Kenya. Thank you so very much to each and every one of you who has been part and parcel of the show from the time we began at 6:30 a.m. till this very moment. My name is Vivian Degwa. We do meet tomorrow, same time and place, God willing. Do enjoy the rest of your viewing. Goodbye.